You had a 4 days marathon Viva, and please, I've told I've taken few students in the last lap. Please rectify your routine and spend some time in the practical, 4 months left in the practical class just to identify organs and everything. Don't take it lightly. Okay, now today's topic is head, neck and face, blood vessels and lymphatics, because today's routine is the parotid, but I have finished parotid the previous day. Now the head and neck receive major blood supply from the carotid arteries, common internal and external carotid arteries, subclavian arteries. This is the right subclavian artery, this is the left subclavian artery, this is the left common carotid artery, this is the right common carotid artery, intercarotid artery, external carotid artery. Now you see this picture, you have to note, you see this is a practice figure, you have to know. Now subclavian artery, the right and left subclavian artery supply mainly the upper limbs and partly to the neck and brain. As it passes deep to the clavicle, it is called subclavian. It passes deep to the clavicle, so it is subclavian, below the clavicle. Now, the beginning right subclavian artery arises from the brachiocephalic trunk behind the right sternoclavicular joint, and the left subclavian artery arises from the arch of the aorta and ascends up to the left sternoclavicular joint in the superior mediastinum. Course, the subclavian artery undergoes a curved course with an upward convexity. It extends from the sternoclavicular joint to the outer border of the first rib. Okay. The first rib, I'll show you next figure. Now again, I use the flow sheet. Subclavian artery, beginning right subclavian branch of brachiocephalic trunk and left subclavian artery branch of aorta. This is the point to note. The right is from the brachiocephalic trunk and the left subclavian artery is the branch of the aorta. Now, termination continues as the axillary artery at the outer border of the first rib. Now, first part of up to the medial border of the scalenus anterior, second part behind the scalenus anterior, third part from the lateral border of the scalenus anterior to the outer border of the first rib. The first part branches vertebral artery, internal thoracic artery, thyrocervical trunk, inferior thyroid, transverse suprascapular, costocervical trunk only on the left side, superior intercostal, deep cervical, second part costocervical trunk only on the right side, third part dorsal scapular artery. Now this picture you have to see the scalenus anterior muscles here. You studied ribs. There's a ridge, a small ridge on the rib. That is the scalenus anterior rises from the first rib. Now, this is the axillary artery. This is the first costochondral rib, the sternum manubrium, sternum. The first part, this is third part. Now relations, the anterior relation of the first part, skin, superficial fascia, proximal muscle, sternocleidomastoid muscle, the investing layer of deep cervical fascia, anterior jugular vein, sternohyoid, sternothyroid, infrahyoid group of muscles. Now, common carotid artery, internal jugular vein, vagus nerve, vertebral vein. Now, the posterior relation, suprapleural membrane, cervical pleura, apex of the lung. Now, relations of the second part, skin, superficial fascia and platysma muscle, sternocleidomastoid with investing layer of deep cervical fascia, subclavian vein, here in the first part is the jugular vein, anterior jugular vein. This is the subclavian vein, trailing nerves only on the right side, scalenus anterior, posteriorly suprapleural membrane, cervical pleura and apex of the lung, lower trunk of the brachial plexus and sclerus medius muscle. You of the head neck, you just draw single sketches and you insert in, you draw the diagram and 1, 2, 3, 4 the relation of the first part of the anterior, relation of the second part of the anterior. Okay. Now relations of the third part, supraclavicular triangle, lower part of the anterior posterior triangle of the neck, middle 1/3 of the clavicle, subclavian vein, external jugular vein, transverse cervical and suprascapular vessels, anterior jugular vein, posterior suprapleural membrane, cervical pleura and apex of the lung, lower trunk of the brachial plexus, sclerus medius muscle, superior, upper and middle trunks of brachial plexus, inferior, the first rib. Now the relations, these are possible in, you break up short questions, 4 marks or 2 marks, one portion only, one portion. So this is very important, this head neck region, this portion, very important. And you plus when you are asked for the first rib to hold in practicals, you might be asked, if answering very well, you will be asked what are the relations of the now see this plane of section, the schematic diagram to show relations of the right subclavian artery. This is the apex of the lung, like this diagram, cervical pleura. You have to practice suprapleural membrane, sclerus medius muscle, lower trunk of brachial plexus and subclavian artery, sclerus anterior muscle, suprascapular transverse cervical arteries, subclavian vein. This is the perivertebral fascia, the green. The fascia are in green. The brown is muscle, yellow is nerves. And now, the investing layer of deep cervical fascia. The when you are taught the cervical fascia and also the sternocleidomastoid in the head neck region dissection, then you will be seeing the investing layer of deep cervical fascia and the sternocleidomastoid, platysma muscle, skin. Now this is the prevertebral fascia. This. Now the subclavian artery gives 4 branches from the first part except the costocervical trunk, which on the right side arises from the second part. Branches from the first part, vertebral artery, internal thoracic artery, thyrocervical trunk, inferior thyroid artery, transverse cervical artery, suprascapular artery, costocervical trunk only on the left side. Now, a superior intercostal artery, one deep cervical artery. Branches from the second part, costocervical trunk only on the right side. Branches from the third part, dorsal scapular artery, occasionally branch, if present, it replaces the deep branch of the transverse cervical artery. Pneumonic for branches of the first part of the subclavian arteries, vitamin C and D, and for the thyrocervical trunk is SIT. Now, The subclavian artery and its branches on the right anterior view. This is the transversacervical artery, the suprascapular artery is here, and thyrocervical trunk arising from the aorta, the dorsal scapular artery here, now subclavian artery, axillary artery. Now this is the internal thoracic artery. Now the cut end of the clavicle, you see behind the clavicle, just above. First costal cartilage. Now this is the thyrocervical trunk, this is the vertebral artery, inferior thyroid artery, scalenus anterior muscle, this is muscles arising from the rib, and see the vertebra in the vertebra, the cervical vertebra. Now scalenus anterior and scalenus medius muscle. Now you see the internal, now this is the branches of the right and left subclavian artery. This is branches. Now here internal thoracic artery goes up, thyrocervical trunk, costocervical trunk, and dorsal scapular artery. This is dorsal scapular artery. Now these are the vertebral arteries rising, goes up into the neck through the vertebral, the transverse process as foramina. That is the uniqueness of the cervical vertebra. Now, now it is the inferior thyroid artery, the transverse cervical artery, the suprascapular artery, thyrocervical trunk. These are the vertebral arteries, the costocervical trunk left, and dorsal scapular artery. Now some interesting facts. The right subclavian artery develops from the three sources: right fourth aortic arch, part of the right dorsal aorta, and the right seventh intersegmental artery. The left subclavian artery develops from the seventh intersegmental artery. Now you see the portion, the right subclavian artery develops from the three sources, and the left subclavian artery develops from the left seventh intersegmental artery. So the right developing from three sources. Now, pulsation of the subclavian artery. The subclavian artery can be palpated in the supraclavicular triangle by pressing it against the first rib here. Third part of the subclavian lies superficial. Ligation of the subclavian artery to prevent the loss of blood in the upper limb injury of the amputation or the amputation of the upper limb. The third part, subclavian artery, may be ligated in the supraclavicular triangle. Ligation of your subclavian artery to prevent the loss of blood in the upper limb injury or the amputation of the upper limb. Third part of the subclavian artery may be ligated in the supraclavicular triangle. Now, this figure you must know, and the uniqueness of the cervical vertebra, it is having a foramen. In the practical class, in osteology, a tray of bones will be there. So, you have to pick up, if the examiner asks you, pick up a cervical artery. Once you pick up the cervical artery, you want to pick up your bone, the vertebra, cervical vertebra, then you see there is a foramina, very good picture. Now, the spine, the vertebral spine is supported by the muscles and everything. Yet, this by nature, the vertebral artery is protected because of the neck flexibility, like this. The your artery, it's not supported. Then it might be just one, it might get blocked. Supply to the brain is lost. So this is adaptation by nature, and your the first part of the subclavian artery, part of the vertebral artery, transverse process of C6, second part of the vertebral artery here. Now you see it is going through the foramen of the transverse processes and the basilar artery, fourth part of the vertebral artery. Now, write a short note of vertebral artery. There is a question there. Now, it is one of the main arteries that supply the brain and the spinal cord. Beginning, it arises from the upper surface of the first part of the subclavian artery. Course, it passes upwards to enter the foramina transversarium of the 6 cervical vertebra here and traverses upward in the foramina transversus of 6 cervical vertebrae. After emerging from the foramina transversus of the first cervical vertebrae, this artery winds up backwards the lateral mass of the atlas. Further, the artery enters the cranial cavity through the foramina magnum. In the cranial cavity, at the lower border of the pons, it joins with the similar artery of the opposite side to form the basilar artery. Now, it goes, single artery goes like this. You can see, and if you have seen your skull, you see the foramen magnum. So it goes and meets and then supplies the brain. Now, vertebral artery, the vertebral arteries join with each other in the midline cranial cavity, lower border of the pons to form a basilar artery, single basilar artery. Now, based on the location, the vertebral artery is divided into 4 parts. First, cervical part, it extends from the first part of the subclavian artery to the foramen transversarium of the 6 cervical vertebrae. Second vertebral part, this is first part. Second part here. This is the transverse process, the third part. And this is the fourth part in the foramen magnum. Now, based on location and vertebral artery is divided into 4 parts of follows. Cervical part, it extends from first part of the subclavian artery to the foramen transversarium of C6 vertebra. Second vertebral part, it lies within the foramen transversarium 6C to C1. Third suboccipital part extends from the foramen transversarium of C1 vertebra, the foramen magnum of this skull. Yeah, this foramen magnum. This one. You draws head neck region. You please do sketches. The portion is small. And now I told you previous day and the beginning of the when you started college, in the beginning, I told you just do sketches, just straight line draw and study. When you are feeling asleep, then you just take a book and start. I told you that you study anatomy from 10 p.m. to 12. Then go to sleep. And you have one khata, you go and draw and label it. It will retain in the brain. Now, some interesting facts. The first part of the vertebral artery is present in the stenovertebral triangle. The loop of the third part of the vertebral artery dampens down the arterial pulsation within the cranial cavity. The third part of the vertebral artery lies within the suboccipital triangle. Remove the semispinal capitis to visualize the third part of the vertebral artery in the suboccipital region, triangle. Here it lies over the posterior atlanto-occipital membrane. Now, vertebral artery branches in the neck, spinal branches, muscular branches. In the cranial cavity, they arise from the fourth part of the vertebral artery, meningeal branches, posterior spinal artery, anterior spinal artery, posterior inferior cerebellar artery, and the medullary branches. Now, all this, pons, medulla, even when I taught you the cervical vertebra, I told you about the homicide or suicide by hanging. I told you the homicide, suicide. You can see the now see all the process in the cranial cavity. They rise from the fourth part of the vertebral artery. This is the fourth part. See, Tripura, magnum, basilar artery. Now the meningeal branches, the posterior spinal artery, anterior spinal artery, posterior inferior cerebellar artery, medullary branches. Medulla, pons, medulla, cerebellum. Now it gets hung means fracture, but if you homicide, उसको पूरा इंजेक्शन दे के और by hitting hard a blow in the head, any form, or stab, the vertebral arteries are intact, the cervical vertebrae are intact, but then they hang it, but it will be intact. There won't be, so homicide and suicide, the repetition. Now, some interesting facts, spinal branches. Second cervical part, vertebral artery enter the vertebral canal through the intervertebral foramina and supply the cervical part of the spinal cord and meninges. Muscular branches arises from the third suboccipital part of the vertebral artery, supply the muscles around the suboccipital triangle of the neck. Intracranial branches are described in the next class. Now you can see the development. Now clinical integration. Now Subclavian Steal Syndrome. This is a short note. Subclavian Steal Syndrome. Short note. What does it mean? The obstruction of the subclavian artery proximal before to the origin of the vertebral artery results in this syndrome. In this case, the blood from the brain enters the vertebral artery and then to the subclavian artery distal to the obstruction. It may result in ischemia and neurological symptoms. See the right cervical, the right vertebral artery, this is the right subclavian artery, and see blocked by thrombus, left subclavian artery, this is blocked by subclavian. So it goes to the right, left vertebral artery and basilar artery. So you get this neurological results in ischemia and neurological symptoms. Internal thoracic artery is also called internal mammary artery. It rises from the inferior surface of the first part of the subclavian artery opposite to the origin of the thyrocervical trunk. Here, internal thoracic artery. These are the branches. Pericardiophrenic artery here, mediastinal branches, and the sternocostal muscle outline. This is the outline of the sternocostal muscle. Now, sternum and superior epigastric artery goes here. This is musculophrenic artery. Now, termination, it divides into two terminal branches at the sixth intercostal space. Musculophrenic artery, superior epigastric artery, and then branches the pericardiophrenic artery, mediastinal branches, pericardial branches, sternal branches, anterior intercostal arteries, musculophrenic artery, and superior epigastric artery. Thyrocervical trunk, it is a short, wide branch of subclavian artery. Beginning at, it rises from the superior surface of the first part of the subclavian artery along the medial margin of the sternus anterior muscles. Termination, it divides into three branches: inferior thyroid, superficial cervical, and suprascapular arteries. Branches: inferior thyroid, ascending cervical, inferior laryngeal, tracheal, esophageal, and pharyngeal branches. The transversacervical artery divides into superficial and deep cervical branches, suprascapular artery. Previously, all the diagrams have been shown to you. Now see the apex of the lung. Now, costocervical and thyrocervical trunk, right lateral view. Now this is the vertebral artery, costocervical trunk. Yeah. Transverse process C7 vertebral deep cervical artery, superior intercostal artery, neck of the first rib. First posterior intercostal artery, second rib, second posterior intercostal artery. Now this is the subclavian artery, this is the vertebral artery branch, the inferior thyroid artery, the transversacervical artery, suprascapular artery, thyrocervical trunk, subclavian artery, internal thoracic artery, cervical pleura. Thyrocervical and costocervical trunk. Now, inferior thyroid artery is a branch of thyrocervical trunk. It has ends in the medial border of the sternus anterior, turns medial just below the sixth cervical transverse process. It further descends to the lower pole of the thyroid gland. Here it passes between the carotid sheath and vertebral artery. Left inferior thyroid artery is crossed anteriorly by thoracic trunk. Close to the lower pole of the thyroid gland, this artery accompanied by recurrent laryngeal nerve. Now, when you have read thyroid, you will be reading thyroid. Then, during the operation of the thyroid, you have to be cautious about the recurrent laryngeal nerve, because after the operation, after 48 hours or 72 hours, the patient complains of hoarseness of voice. That means the recurrent laryngeal nerve is injured. Okay. Now, branches of inferior thyroid artery gives the following branches: ascending cervical artery, inferior laryngeal artery, pharyngeal, esophageal, and tracheal branches to supply these structures. Transverse cervical artery divides into superficial cervical and deep cervical branches. Superficial cervical, it passes upwards and laterally. It crosses anterior to the phrenic nerve, sclerus anterior, and the brachial plexus. It enters the posterior triangle of the neck behind the sternocleidomastoid. It crosses the floor of the triangle to reach the anterior border of the trapezius. It anastomosis with the superficial ramus of the descending branch of the occipital artery. Note, in 1/3 of individuals, the superficial cervical and dorsal scapular arteries as a common branch from the thyrocervical trunk. Suprascapular artery arises from the beginning of the superficial cervical artery. It passes laterally across the sclerus anterior, phrenic nerve under the cover of the sternocleidomastoid. It further passes in front of the subclavian artery, and cords of the brachial plexus posterior to the clavicle, subclavian and inferior belly of Homo high. It appears supraspinous fossa of scapula and passes superior to the supraspinous ligament and participate in the scapular anastomosis. Now, these when you are doing the head neck dissection, there will be lectures on the head neck. So you will revise and see a costocervical trunk. Beginning, it arises from the posterior aspect of the subclavian artery as follows. On the left side, from the first part of the subclavian artery. On the right side, from the second part of the subclavian artery. Course, the artery passes backwards and above the cupula of the pleura. Termination, it divides into two terminal branches, deep cervical and superior intercostal arteries at the level of the neck and the first rib. Branches, deep cervical artery, superior intercostal artery gives the first two posterior intercostal arteries. This is the repetition. Now, deep cervical artery passes backwards above the C8 spinal nerve between the neck of the first rib and then transverse process of C7 vertebra. It ascends upwards up to the second cervical vertebra and supplies adjacent muscles, vertebra and spinal cord. Superior intercostal artery descends in front of the neck, upper two ribs and gives first two posterior intercostal arteries. Now, dorsal scapular artery beginning, it arises from the third part of the subclavian artery, passes laterally to the trunks of the brachial plexus and passes deep to the levator scapulae. It runs along the dorsal scapular nerve, along the medial border of the scapula and supplies rhomboids. It participates in scapular anastomosis. Now, compression of the subclavian artery. The third part of the subclavian artery may be compressed against first rib after depressing the shoulder to present the blood loss from the upper limb. Cervical rib and compression of subclavian artery. The cervical rib may compress the subclavian artery. Clinical finding Adson's test. In this case, when the patient turns the chin upward and to the affected side, a radial pulse diminishes to the inspiration. This is Adson's test. Now you see in the case of the patient turns the chin upward and to the affected side, then the radial pulse diminishes. Okay. And pulses on deep inspiration. You just see, you just like this, and then your pulsation will diminish. Now, that is Adson says, aneurysm of the subclavian artery occurs mostly in the third part of the artery. It may compress the trunk of the brachial plexus, which leads to weakness, numbness in the upper limb. Now, this content, the nerves, that's why you complain of tingling sensation of the upper limb, sometimes pain in the neck, then sometimes vertigo due to some hypertension and other causes. Now, the physician or you will be prescribing, advising an X-ray to see the condition of the it may compress the trunk of the third part, the aneurysm. Aneurysm to pulsation देखते पाओगे, ठीक है जी? And you see what happens now. Modern times, nerve conduction velocity test. Nerve conduction, there are some machines that can, if there is a flow, the sensation in the nerves. What is the condition of the nerves? The common carotid artery The right and the left common carotid arteries are the chief arteries of the head and neck. Please focus. Common carotid arteries, the right common carotid artery and the left common carotid arteries, and your right common carotid artery arises from the brachiocephalic artery behind the right sternoclavicular joint. Left common carotid artery arises from the arch of the aorta. Previously I told you, in the thoracic cavity, it ascends towards the left sternoclavicular joint, course in the neck. Both the common carotid artery in the neck have similar course. Each artery runs upwards from the sternoclavicular joint to the upper border of the lamina of the thyroid cartilage, that is up to the level of the intervertebral disc between the C3 and C4 vertebra. Now at this level, it terminates by dividing into external and internal carotid arteries. You see, when you are, now leave aside your pulse oximeter or your cardiac monitors or something. If the patient comes in emergencies, you feel the pulse. If you are not getting, sometimes what happens, the patient is pulseless, and again you are feeling your pulsation. So you go and see the carotid pulsation. And also you make a torch, you take a torch or your torch, and then you see the iris, the pupil is dilated. If he is dead, but if there is a thing, you just blink, you just put your finger over the cornea, you see there will be, you will blink, or when you put the light, the pupils constrict. It becomes, but if death, you feel the pulse over here, again you want to further confirm yourself, then you have to do these tests. Okay? Now, termination, each carotid artery divides into external carotid and internal carotid at the level of the upper lamina of the thyroid cartilage, at the level of intervertebral disc between C3, C4 vertebra. Now, the common carotid artery lies within the carotid sheath, medial to the internal jugular vein. The vagus nerve lies posterior to the internal jugular vein and common carotid artery. The common carotid artery is overlapped by sternocleidomastoid. See the muscles, you feel your own carotid pulsation, and your sternocleidomastoid muscle also you turn, it becomes a band like here from your mastoid process to the sternum. Okay. Now, see the carotid pulse. The common carotid artery can be palpated against the anterior tubercle of the sixth cervical vertebra called carotid tubercle. The Castellanic tubercle, it lies about 4 centimeters above the sternocleidomastoid, the sternocleidomastoid joint at the level of the cricoid cartilage. This is the cricoid cartilage. The upper border of the thyroid cartilage. This is the hyoid bone. Now, cricoid, external carotid artery displacement that we have to see. Internal carotid artery, again, has branches. Internal carotid artery is the main supply of the brain and the eye. Internal carotid artery is the main supply of the brain and the eye. Internal carotid artery, terminal branch of common carotid artery, level of upper border of lamina of thyroid cartilage at the level of the intervertebral disc between C3 and C4. The internal carotid artery, that's why I am telling you, you just draw your figure and level you mark. If you draw the picture and just label it, you get full marks. Cerebral Now, your internal carotid artery divides into the following four parts. Cervical part lies in the neck. The petrous part, it lies within the petrous temporal bone. The cavernous part, it lies in the cavernous sinus. Cerebral part, it lies in the base of the brain. Termination, the fourth cerebral part of common carotid artery termination by dividing into anterior, middle and cerebral arteries. The branches, cervical part, no branch, petrous part, carotico-tympanic branches. That means it is supplying the tympanic membrane, the carotico-tympanic membrane. Okay. Cavernous part. Pterygoid branch, cavernous part, cavernous branches, superior and inferior hypophyseal arteries, cerebral part, ophthalmic artery, anterior choroidal artery, posterior communicating artery, anterior cerebral artery, middle cerebral artery. You will have beautiful pictures in your atlas, in your book, of these blood supply of the brain and the eye. And this you draw, see, and externally it is the external meatus. This is the internal part. That you see the zygomatic process of the temporal bone, the external meatus, then the mastoid, the petrous part. Now, through this, there's one branch in the corticotympanic. Carotico-tympanic branches, the cerebral senior and the superior and inferior hypophyseal arteries, cerebral part. Now, the cerebral part, ophthalmic artery, anterior choroidal artery, posterior communicating artery, anterior cerebral artery and middle cerebral artery. Now, this is the practice figure. Now, you see the cervical part, no branches of internal carotid. Petrous part, corticotympanic branches. Through the pterygoid canal, it goes one branch, the corticotympanic branches, carotid sheath, carotid canal. And then this is the cavernous part, cavernous branches. The superior hypophyseal artery. This is the pituitary gland, supplied to the pituitary gland. See, middle cerebral artery, anterior cerebral artery, posterior communicating branch, anterior choroidal branch, cerebral part, ophthalmic artery and optic canal. It's all repetition. Now, subclavian vein. Now, write a short note on subclavian vein. Beginning, it is the continuation of the axillary vein at the outer border of the first rib. Termination, the subclavian vein joins the internal jugular vein to form the brachiocephalic vein along with the medial border of the sphenoid anterior muscle. Quote, the subclavian vein extends from the outer border of the first rib to the medial border of the sphenoid anterior muscle. It arches over the cervical pleura. Relations, anterior clavicle subclavian muscle, posterior sphenoid anterior phrenic nerve and subclavian artery, inferiorly first rib and cervical pleura. Now, tributaries, external jugular vein, dorsal scapular vein, thoracic duct on the left side, right lymphatic duct on the right side, occasional tributaries, anterior jugular vein, vein from the cephalic vein. See, this is the type of figure I am trying to explain to you, that you draw like this. Right internal jugular vein, vertebral vein. Now, right lymphatic duct, external jugular vein, dorsal scapular vein, right subclavian artery. Now, right superior intercostal vein, right brachiocephalic vein, and the superior vena cava. Now this is the vertebral vein. Now inferior thyroid veins. Now this is the inferior thyroid vein. This is the thoracic vertebral vein, left internal jugular vein. Now external, this is thoracic duct, external jugular vein. Dorsal scapular vein, left subclavian vein, internal thoracic vein. First, posterior intercostal veins. This is left superior intercostal vein, the left brachiocephalic vein. Please go home and study this because you have to do the self-study. I'm telling you the portions which are important. I've told you. And now, clinical integration, catheterization of subclavian vein. It is a percutaneous cannulation of the subclavian vein. It is useful for the placement of large catheters in critical ill patients or those who require prolonged intravenous therapy. For this, the subclavian vein can be approached through supraclavicular or infraclavicular approach. The other veins used for central venous catheterization are internal jugular vein, femoral vein, and axillary vein. Subclavian vein thrombosis, SCVT. It is a condition where the blood clot forms in the subclavian vein. It may be primary or secondary. Excessive use of arm exercise may cause primary thrombosis, whereas amputation, infection, catheterization may cause thrombosis. Internal jugular vein. Now, it begins at the continuation of sigmoid sinus at the base of the skull at the jugular foramen. Now, termination, it ends by joining the subclavian vein to form the brachiocephalic vein behind the medial end of the clavicle. Features superior bulb. It is a dilatation at the beginning of the internal jugular vein. It lies in the jugular fossa of the temporal bone. And inferior bulb, it is a dilatation near the termination of internal jugular vein. It lies in the lesser supraclavicular fossa. The larger right internal jugular vein, the right internal jugular vein is larger than the left as it is directed continuation of larger right sigmoid sinus, larger superior sagittal sinus. The left internal jugular vein is a continuation of smaller left sigmoid sinus, smaller inferior sagittal sinus. Enclosed within the carotid sheath, internal jugular vein, carotid arteries, vagus nerve are endorsed with the carotid sheath with the thinner around the vein. The lymph nodes, the deep cervical nodes are along the entire internal jugular vein. Lymphatics at the jugulus subclavian angle. On the left, the thoracic duct opens, whereas on the right lymphatic duct opens. See the right sinus, this is the bulbous, the jugular foramen, left sigmoid sinus, your common facial vein, occipital vein, lingual vein, superior hyoid vein and middle thyroid vein, and your thoracic duct, left subclavian vein, brachiocephalic vein, right lymphatic duct and right subclavian vein. These are our repetition of cannulation. Cannulation of internal jugular vein. The cannulation of internal jugular vein can be cannulation through the apex of the lesser supraclavicular triangle that lies between the two heads of the sternocleidomastoid. Yeah. Sternocleidomastoid, the needle should be directed backwards and upwards to avoid the puncture of cervical pleura. It is punctured, it will lead to pneumothorax. So you have to be very careful of your cannulation of the internal jugular vein because in the previous slides I've showed you the apex of the lung is there. Naturally there will be pneumothorax. It will suddenly collapse and respiratory distress will be there Now, thrill can be felt sometimes at the lesser supraclavicular time during arterial systole, especially in cases of mitral stenosis. We can start, we can start test compression of the internal jugular vein increase the rate of CSF flow during lumbar puncture. Block in the spinal subarachnoid phase results in the failure of this increase. Compression of the internal jugular vein increases the rate of CSF flow during the lumbar puncture. Block in the spinal subarachnoid space results in the failure of increase of CSF flow. Cervical lymphadenopathy and internal jugular vein. The internal jugular vein is a surgical guide for removal of cervical lymph nodes in malignant tubercular lymphadenopathy or lymph nodes often adhere to internal jugular vein and dissection of such lymph nodes may be difficult. It may require removal of a segment of the internal jugular vein. So, if there is a malignant your internal jugular lymph nodes, it is adherent in a portion of the internal jugular vein. In between clamps, it can be dissected out. In cervical lymphadenopathy, now see the picture, the outer group, the occipital nodes, the lymph nodes of groups in this region of the higher head and neck. Occipital nodes, mastoid, superficial parotid, preauricular, submental, submandibular, jugulo-digastric lymph nodes, jugulo-omohyoid lymph nodes, and the paratracheal, retropharyngeal inner group, deepest, and these are the paratracheal, pharyngeal, and so if there is any lymph node swelling, you have to palpate by region wise, and you can palpate, you will see, and also the see a scalp, your some abscess or hematoma followed by abscess, fall or danda, mara. So there is your scalp hematoma is there. Now, in those cases, you can see the lymph nodes, palpate, and also the preauricular in the parotid, submental, and your nodes in this region. Total 300 nodes here. Peripheral nodes, outer group, submental, submandibular, superficial parotid, mastoid, occipital. So, if there is a swelling in these regions, then you have to look into that where it is. And if it is a tuberculosis or some other relation, you do an FNAC, fine needle aspiration cytology. Okay. Now, inner group, infrahyoid, pre-laryngeal, pre-tracheal, paratracheal, retropharyngeal. That picture, that is circle, that has been posted in this. Now, block dissection of the neck, Commando Operation for their treatment of cancers of the head and neck region. Most of the cervical lymph nodes are surgically removed in the block dissection of the neck, especially which lies along the internal jugular vein and sternocleidomastoid muscle. Part of the mandible or oral cavity is dissected out for treatment of oral cancer in the Commando Operation. Sometimes portion of the mandible is dissected out, and the lymph nodes, the block dissection of the your cervical lymph nodes. This is known as the Commando Operation. Now, Some facts. The thoracic duct is the largest lymph trunk of the body. It opens at the junction of the left subclavian and left internal jugular veins. There, the right lymph trunk opens at the junction of the right subclavian and right internal jugular veins. For you read in the book, the right lymph trunk receives right jugular trunk, right subclavian trunk, and the right bronchomediastinal lymph trunk. Here is the area drained by the thoracic duct. This. The area drained by the right lymphatic duct. This portion. The thoracic duct, you see, you just draw a figure like this, and you bring at the elbow region, then the total right side drained by right lymphatic duct. Now, this is the area where the drained by the thoracic duct. Thoracic duct can come as a question. It's important. It is important, long question, it's important. And now the right of the head, neck, right upper limb, right chest wall, right lung, right half of the heart, and right half of liver.